This is the Coronavirus Morning Report for Monday, April 6, 2020. I'm Brian McCullough. From overseas, a bunch of numbers heading in the right direction, even as the U.S. death toll will pass 10,000 today. More men than women are dying of COVID-19. The Swedish experiment is about to be tested. Bill Gates' big, expensive vaccine experiment is outlined. And why are British 5G cell phone towers burning down? Unfortunately, the number of U.S. coronavirus deaths will no doubt reach 10,000 at some point today, possibly by the time you are hearing these words. But let's hit up a series of good news numbers from around the world, quoting the Washington Post. The government in Italy announced 525 new deaths from the coronavirus on Sunday, a figure that suggests the pace of fatalities in the country may be slowing. The figure is the lowest new death count since March 19. The highest number was recorded on March 27th, when Italy's Civil Protection Agency announced 919 new deaths. Sunday's number brings Italy's cumulative death toll to 15,887. The government also announced 4,316 new cases, bringing the total number of confirmed cases to 128,948, end quote. Italian authorities also said that for the first time since the beginning of the outbreak, the use of intensive care beds fell. Spain on Monday announced only a 3% increase in new cases from the day before, which is the lowest growth in new cases since the pandemic began. Yes, 637 people died in the last 24 hours, but that is also the smallest number of deaths recorded in Spain in the last 2 weeks. And more than 38,000 people have recovered and been released from Spanish hospitals as recovered patients. Australia is also striking a cautiously optimistic tone. Australian Chief Medical Officer Brendan Murphy said that there had been 139 new cases in the past 24 hours, which was part of a continuing trend of less and less new cases each day. That is the lowest rise we've had in a few days, and it does tend to continue the trend we've seen of flattening the curve, he said at a news briefing in Canberra. There have been 5,687 cases and only 34 deaths thus far in Australia. In South Korea, new infections dropped below 50 for the first time since February. Back to the United States, the state of Texas is screening and quarantining drivers entering from the state of Louisiana. And a follow-up from something we discussed last week, quoting the Washington Post, California's backlog of coronavirus tests has been substantially reduced from 6,000 to 13,000. Governor Gavin Newsom announced during a Saturday news briefing in Sacramento. But even now, Newsom said the state's testing hasn't been adequate. Quote, "The testing space has been a challenging one for us, and I own that," he said. "You deserve better and more," end quote. A total of 126,700 Californians have been tested for the virus. California has 12,026 positive cases as of Saturday, a 12.4% increase in 24 hours. About 2,300 people are hospitalized, and 1,008 of them are in intensive care units in the state. In comparison, 271,000 New Yorkers have been tested, 94,000 Floridians, and 63,000 Texans. To address testing concerns, Newsom announced a state partnership with UC Davis and UC San Diego that would expand testing capacity and also a statewide task force to determine best practices, end quote. A new graph from the COVID Tracking Project shows the percentage of confirmed cases in various U.S. states that require hospitalization. The graph shows huge, troubling numbers in these most severe of cases. 29% of confirmed cases in Mississippi require hospitalization, 28% in Wisconsin, 23% in New York, and 19% of cases in Georgia require trips to the hospital. This suggests that if you get the disease, the odds are somewhere between 1 in 3 and 1 in 5 that you will require hospitalization. Maybe. As Dr. Scott Gottlieb tweeted, since on average between 10 and 15% of cases require hospitalization worldwide, it is hopefully more likely that these increased hospitalization numbers in the U.S. merely mean that we are continuing to underreport the total number of cases. Also, the Washington Post, quote, Tokyo is seeing a steep rise in new coronavirus cases amid growing fears that Japan is on the brink of a surge in infections after eschewing draconian containment measures for weeks. The Asian metropolis of 14 million people counted a record high 130 new cases on Sunday, Japanese media reported, citing local officials. The latest countrywide case numbers have not yet been publicized, although the figure stood at roughly 3,500 on Saturday. Japan has counted 95 deaths, end quote. This morning, the Japanese Prime Minister declared a state of emergency in 7 prefectures, asking people to stay indoors, but trains will still run and supermarkets will remain open. And yes, a tiger at the Bronx Zoo here in New York City has tested positive for coronavirus, thus becoming what is believed to be the first infected animal in the United States. The tiger is believed to have contracted the disease from a zoo employee, quoting the New York Times. The Centers for Disease Control and Prevention has said that it is, quote, aware of a very small number of pets outside the United States reported to be infected, end quote, but that it does not have evidence that pets can spread the coronavirus, end quote. Coronavirus seems to be more deadly for men than women in the U.S., an emerging statistic that mirrors similar findings in other countries. Quoting from the Washington Post, which investigated this phenomenon using state-level data in the U.S., quote, in the United States, women make up a slightly larger percentage of the population to begin with, which may help explain why in many states they're contracting somewhat more cases of the disease. But men consistently die more often. That's true in Michigan, where men represent 61% of the state's 479 deaths so far. Of the 284 people killed by the coronavirus in Washington state, 57% are men. In Florida, men made up more than 61% of the 163 fatal cases as of Friday. There, 53% of cases are in men. This trend holds in at least 10 other states and New York City that report gender-identified mortality data, and it matches a pattern now recognized by epidemiologists around the globe. From China to South Korea to Italy to France, men are dying more frequently of COVID-19 than women, end quote. A combination of factors are likely at the root of the difference. Fundamentally, genetic females have 2 copies of the X chromosome on which is coded a large number of the genes responsible for immune response. Robin Klein, director of the Center for Neuroimmunology and Neuroinfectious Diseases at Washington University in St. Louis, wrote in the Post that, quote, that fast-working female immune systems may be more effective at clearing the virus from the body in the first week after infection, making women less likely to reach the later stage of precipitous decline, end quote. Writing for Al Jazeera English, GP Dr. Sarah Kayet also noted a possible hormonal advantage. Quote, studies have shown that immunity to viruses varies with changes in hormone concentrations, which occur at different stages of the menstrual cycle, and which can be affected by taking contraception during pregnancy and after the menopause. Therefore, it is feasible that female hormones might be in part responsible for the COVID-19 gender imbalance. This theoretical difference was researched in animal studies during the SARS outbreak in 2002 to 2003. When researchers removed the ovaries of mice, which produce the female hormone estrogen, or treated the female mice with a chemical that blocked the effects of estrogen, they found that mice susceptibility to SARS increased and resulted in an increased rate of death. This implies that estrogen has a protective effect in mice infected with SARS. As the SARS virus and COVID-19 share 79% of the same genetic sequencing, it is possible that a similar mechanism may be at play with COVID-19, end quote. Another potential cause is more behavioral. A Reuters poll found that men are less likely than women to take health risks from coronavirus seriously, which may mean they are more likely to behave in ways that expose them to the virus. Men are also less likely to seek care, but more likely to have an underlying condition that could exacerbate the toll COVID-19 exacts. All these factors together seem to be resulting in the higher COVID-19 fatality rate amongst men. And quoting from The Post, according to the World Health Organization, American men live on average 5 years shorter than their female counterparts and have a higher probability of dying of heart disease, cancer, diabetes, and respiratory illnesses, end quote. Another population in the U.S., both dying and contracting coronavirus at a higher rate, according to early data reported by ProPublica, is African Americans. Not all states track or publish the racial breakdown of people infected with COVID-19, but of the ones that do, the discrepancy is alarming. Quoting ProPublica, as of Friday morning, African Americans made up almost half of Milwaukee County's 945 cases and 81% of its 27 deaths in a county whose population is only 26% black. In Michigan, where the state's population is 14% black, African Americans made up 35% of cases and 40% of deaths as of Friday morning. Louisiana has not published case breakdowns by race, but 40% of the state's deaths have happened in Orleans Parish, where the majority of residents are black, end quote. Due to a confluence of economic, political, and environmental factors over generations, African Americans are already at a higher risk for many conditions like asthma, diabetes, and heart disease, all of which can exacerbate the effects of COVID-19. Looking specifically at Milwaukee County as a case study, ProPublica notes, quote, because of discrimination and generational income inequality, black households in the county earned only 50% as much as white ones in 2018, according to census statistics. Black people are far less likely to own homes than white people in Milwaukee and far more likely to rent, putting black renters at the mercy of landlords who can kick them out if they can't pay during an economic crisis, at the same time as people are being told to stay home. And when it comes to health insurance, black people are more likely to be uninsured than their white counterparts. Quote, African Americans have gravitated to jobs in sectors viewed as reliable paths to the middle class: healthcare, transportation, government, food supply, which are now deemed essential, rendering them unable to stay at home. In places like New York City, the virus's epicenter, black people are among the only ones still riding the subway, end quote. Also a factor is a mistrust of the healthcare system or the receiving of subpar treatment when it is sought out. Quoting Milwaukee Health Commissioner Jeanette Kolowick, what black folks are accustomed to in Milwaukee and anywhere in the country really is pain not being acknowledged and constant inequalities that happen in healthcare delivery, end quote. Fred Royal, head of the Milwaukee branch of the NAACP, told ProPublica he's heard of people in Milwaukee being told to go home and self-medicate and then dying at home before the results of their tests come back. Milwaukee County is trying to lead the charge in addressing this racial disparity, however. Last year, they declared racism a public health emergency, and as more data comes out about the rate of infections and fatalities among African Americans, they're targeting their messaging and providing extra resources for people in need of food or lodging. But if other counties and states want to follow their lead, they'll need the data to confirm which populations are hardest hit, and currently the CDC isn't releasing that. Quoting ProPublica, the U.S. Centers for Disease Control and Prevention tracks virulent outbreaks and typically releases detailed data that includes information about the age, race, and location of the people affected. For the coronavirus pandemic, the CDC has released location and age data, but it has been silent on race. The CDC did not respond to ProPublica's request for race data related to the coronavirus or answer questions about whether they were collecting it at all, end quote. 5 members of Congress wrote to Health and Human Services Secretary Alex Azar, demanding the CDC begin collecting and publishing the racial and ethnic breakdown of patients in order to ensure accurate testing and treatment going forward. As Dr. Ashwin Vasan, public health expert and assistant professor at Columbia University, told USA Today, quote, the virus is an equal opportunity crisis, but the impact and burden of it is not going to be shared equally, end quote. Something we've been keeping an eye on has been the fact that there's been one major European country that thus far has been bucking the social distancing trend. Sweden has, until now, resisted social distancing and lockdown measures as a way of controlling the spread of coronavirus, but a significant rise in the death rate in Sweden may be about to change that. Quoting from Bloomberg, the Swedish experiment has drawn international bewilderment as schools, restaurants, and cafes have remained open. And while other countries pass laws restricting movement, Sweden's Prime Minister Stefan Löfven relied on the common sense of his fellow citizens to carry his country through the pandemic. But after a week of sobering data, Löfven now seems to be striking a darker tone. In an interview published on Saturday by Dagens Nyheter, he warned that Sweden may be facing, quote, thousands of coronavirus deaths and said the crisis is likely to drag on for months rather than weeks, end quote. As of Saturday, 373 people in Sweden had died of COVID-19, bringing Sweden's deaths per million rate to 36. That compares to a 29 per million death rate in Denmark and just 9 per million in Norway, both of which have implemented stronger lockdown measures. Quoting from Bloomberg, Sweden has already taken a few steps toward more restrictions. It recently banned gatherings larger than 50, compared with 500 previously, and restaurants can only serve patrons while they're seated at tables, not while standing at bars. Visits to retirement homes for the elderly are banned, and Löfven has made clear stricter instructions may follow. But it remains a far cry from measures taken elsewhere. In neighboring Denmark, citizens face hefty fines and even prison sentences for breaking new coronavirus laws. Löfven has so far sought to play down the role of legislation in shaping Sweden's response. Quote, "We will never be able to legislate everything. We will never be able to ban all harmful actions," Löfven said last week. "We as individuals must take our responsibility," end quote. Obviously, for all our sakes, we need to avoid crowds in any way we can right now. But what if you need to go to the post office? What if you need postage to send out letters and packages? Don't worry, Stamps.com is here to help. Anything you can do at the post office, you can do at Stamps.com. Print postage on demand and skip those lines and crowds at the post office. Stamps.com brings all the services of the U.S. Postal Service right to your computer in the safety and comfort of your own home, office, or anywhere else you're hunkering down right now. Whether you're a small business sending invoices, an online seller shipping out products, or you're just working from home and need to mail stuff, Stamps.com can handle it all with ease. Simply use your computer to print official U.S. postage 24/7 for any letter, any package, any class of mail, anywhere you want to send it. Once your mail is ready, just leave it for your mail carrier, schedule a free package pickup, or drop it in a mailbox. No human contact required. It's that simple. Right now, our listeners get a special offer that includes a 4-week trial plus free postage and a digital scale without any long-term commitment. Just go to Stamps.com, click on the microphone at the top of the homepage, and type in briefing. That's Stamps.com, enter briefing. Stay safe, my friends. Life feels more stressful these days. No kidding. Stores are empty, travel is on pause, work is uncertain. With social distancing now, we need support more than ever. Talkspace Online Therapy gives you the support you deserve on a schedule that works for you. Talkspace lets you match with a licensed therapist from the safety of your home. Get 24/7 messaging across any device and hear back daily. 1 month on Talkspace costs about the same as a single in-person therapy session, but with that unlimited messaging access I just mentioned and daily engagement. No need to travel for support or wait for relief. Talkspace therapists have experience treating a range of issues, including depression, anxiety, substance abuse, trauma, relationship issues, food and eating, and more. We all need to talk through life's challenges, and Talkspace offers the support we deserve at a price we can afford. Match with your perfect therapist and get $100 off your first month with promo code BRIEFING. Sign up at Talkspace.com or download the app. Don't forget to use the promo code BRIEFING for $100 off your first month. Appearing on The Daily Show with Trevor Noah last week, Bill Gates announced that the Gates Foundation will be investing billions of dollars in the construction of 7 different factories to develop the 7 most likely potential COVID-19 vaccines. He believes that, at most, 2 of these vaccines will actually work for mass production, but that the possibility of billions of dollars lost on the other vaccines will still be worth it in the long run.
Governments will eventually come up with lots of money for these things, but they don't know where to direct it. They can't move as quickly. And so because our foundation has such deep expertise in infectious diseases, we've thought about the epidemic. We did fund some things to be more prepared, like a vaccine effort. Our early money can accelerate things. So, for example, there's of all the vaccine constructs, the 7 most promising of those, even though we'll end up picking at most 2 of them, we're going to fund factories for all 7. And just so that we don't waste time in serially saying, okay, which vaccine works, and then building the factory. Because to get to the best case that people like myself and Dr. Fauci are saying is about 18 months, we need to do safety and efficacy and build manufacturing, and they're different for the different constructs. And so we'll abandon, it'll be a few $1 billion we'll waste on manufacturing for the constructs that don't get picked because something else is better. But a few billion in the situation we're in, where there's trillions of dollars, that's 1,000 times more, trillions of dollars being lost economically, it is worth it.
What I love about Gates's approach is that instead of just A/B testing or testing a few options, Gates is like, test all the options. If any of them don't work out, who cares? We'll have learned something. This is quite literally the role that governments used to play in the time of disasters, spending all the money to find a solution and not worrying about the cost until a solution was actually found. Despite being able to move more quickly than the public health sector at the moment, however, Gates warns that the rollout of the vaccine could still be about 18 months away. This initiative follows Gates and his wife Melinda's $100 million donation from early February, which went primarily to organizations already at work on prevention, detection, and treatments around the world. A conspiracy theory circulating on Facebook has apparently led to at least 4 cell phone towers being set on fire in England. The conspiracy theory claims that 5G, the new wireless technology, is responsible for the coronavirus, citing how it had recently been rolled out in Wuhan, in China, and that the virus has spread to other countries who have begun rollout of 5G. The theory conveniently ignores nations hit by the virus where 5G isn't in use yet, such as Iran and Japan, and also conveniently ignores basic facts related to biology and electromagnetism. As baseless as the conspiracy theory is, enough people believe it that telecoms engineers installing fiber optics in the United Kingdom have started being harassed by passersby, and a growing number of 5G phone towers have caught fire in suspected cases of arson. Given the vitality of mobile networks, particularly for emergency services, and the disruptions to service these attacks are causing, the UK is treating the situation as a matter of national security. The director of the National Health Service, Stephen Powis, said in a daily coronavirus briefing, quote, "I'm absolutely outraged and disgusted that people would be taking action against the infrastructure we need to tackle this emergency," end quote. The government is also calling on social media networks to control the spread of the conspiracy theory. In addition to coverage in tabloids and community radio, there are numerous Facebook pages fueling the conspiracy theory and encouraging people to burn 5G towers down. Though, The Verge notes, Russia may be the culprit behind some of the social media pages, as various Russian campaigns have been spreading disinformation about 5G and its effects on people's health for over a year, according to 2019 reporting from the New York Times. And just in case it needed to be said, quoting The Verge, "There is no scientific evidence that links the coronavirus pandemic to 5G, nor any immediate negative health effects of 5G. Full Fact, an independent fact-checking charity in the UK, has explored the claims after a British tabloid newspaper highlighted them recently. 5G uses a higher frequency of radio waves than 4G or 3G, but regulators in the UK have recorded 5G electromagnetic radiation levels well below international guidelines," end quote. As The Verge concludes, quote, "While medical professionals are busy fighting a highly contagious virus, telecoms workers and social media networks are having to fight an equally destructive viral spread of stupidity online," end quote. The Coronavirus Morning Briefing was produced by Ride Home Media, the daily podcast people, written by myself, James Welsh, and Jackson Bird, edited by Jackson Bird. Be well, everybody. Talk to you tomorrow.